Hello and welcome. We are so glad that you joined us today for another Lympha Press webinar. We've been doing webinars over the last few months, especially during this time of social distancing, because it's a great way to connect with our referral sources and with patients on topics that are really important to you. And it is June, which means it is Lipedema Awareness Month. And we couldn't be more proud than to have the most renowned authority on this topic, Dr. Karen Herbst, who will have a presentation for us and then we'll take your questions and answers. With us today is also the president of Lympha Press USA, Eric Ansart. And we are proud because Lympha Press has the only device cleared by the FDA for the treatment of lipedema, this painful fat disorder that affects about 11% of the population. So without further ado, I'm going to hand it over to Dr. Herbst and get your questions ready. We're going to get to as many of them as we possibly can. Dr. Herbst?
Briefly about pain, a little bit more about edema, and then I want to answer some questions. So lipedema tissue is no longer just fat. And I know we've all been waiting for that to happen, and I too was waiting. But now if you look up the definition of fat, you'll find that fat is actually defined as loose connective tissue. What is connective tissue? There are three main types: loose connective tissue, dense connective tissue, and specialized connective tissue. So specialized connective tissue includes cartilage, bone, blood, and even the lymph. Dense connective tissue is tendons, ligaments, and the sheets of connective tissue that are along our muscles and also between our fat layers. And then there's loose connective tissue. So there's areolar, reticular, and then what we're talking about today, adipose tissue. So if you have problems with your adipose or fat tissue, you have a connective tissue disorder. What is in connective tissue? So there are a bunch of cells shown here. And then there's an extracellular matrix made of fibers, and now those include collagen and elastin and other fibers. And then there's a gel, and this gel is made up of glycosaminoglycans, which are basically just repeating sugar molecules. So sugar molecules all lined up together, and they bind water and electrolytes such as sodium. So that's it, just three pieces to the connective tissue. So let's think about lipedema differently. So lipedema is a loose connective tissue disease. And the problem within the loose connective tissue in lipedema is that there's fibrosis and there's edema. Lipedema affects the arms and legs, and this has been described primarily in women, although it can happen in men. It is rare in men, but most of the descriptions are for women. The hands, feet, and trunk are disproportionately unaffected, and you can see that clearly here that the trunk is small, but you can see all of the lipedema tissue on the legs and the arms. And the fact that the hands and feet remain unaffected makes lipedema different from lymphedema. But there is a risk for developing lymphedema if you have lipedema. And what's really striking is the amount of lipedema tissue on this woman's arm. And this tissue right here is very heavy. And fat is not necessarily heavy. In fact, it's less heavy than water. So what is making this tissue heavy? Is it fibrosis and edema? And why is the hand unaffected? So if we think about edema and fibrosis, when we look at the stages of lipedema, in stage 1, the skin is smooth, but if you palpate the tissue, you can feel the nodularity to the tissue. So there's fibrosis deep under the skin. When we look at stage 2, you can see that there's dimpling of the skin. So now there's fibrosis not only in the loose connective tissue, but also in the skin. And then in stage 3, there's also a lot of fibrosis, but edema starts to play a very big role. So in my opinion, there are two forms of fibrosis in lipedema. There's fibrosis between cells, or intercellular, and there's fibrosis outside of cells in the extracellular matrix. This is a picture here on the left of fibrosis between cells in the extracellular matrix. You can see it's pink, and there's a lot of cell death going on. This is a dead fat cell. This is another dead fat cell. So we think there's death of fat cells, inflammation, followed by fibrosis. If we look at this intercellular space or this extracellular matrix, you can actually see the fibers here. And these fibers are thickened. And therefore, the extracellular matrix fibers can become thickened as well as the space between cells. But there's more than just fibers in here. I think what's in here is that glycosaminoglycan gel bound to water and sodium. This is a better picture of that extracellular matrix. You can see all the fibers that allow the skin, for example, to slide along a tendon. And you can see a lot more from Dr. Gimbert Oh if you look online and search for strolling under the skin. So between these fibers are these spaces here. In these spaces are the glycosaminoglycans, the water, and the sodium. We know that fibrotic fat does not reduce effectively after bariatric surgery, and this is in patients who have obesity. We know that lipedema tissue is resistant to bariatric surgery, so it makes sense to me that lipedema tissue is hard to lose because of the fibrotic component. I want to move on to pain just for this one slide. Is lipedema tissue painful? So we know that many women with lipedema have pain when something or someone touches their tissue. But if you look at the 1951 Wold, Allen, and Hines paper, which is what we all refer to, only 40 to 50% of women with lipedema had pain or tenderness in their tissue. So my question is lipedema always painful? If your body looks like you have lipedema, you can't lose the fat by diet, exercise, or bariatric surgery, but you don't have pain, do you not have lipedema? And I don't have the answer to that, but I think it's something I'd like you to think about. Moving on to edema. So what is the definition for edema? It is swelling of soft tissues due to increased fluid in the extracellular matrix. So I made a picture of the extracellular matrix. So here we have a cell, another cell, and here's our extracellular matrix. We also call this our intercellular space. And in here we have our collagen fibers and our elastin fibers, which form part of that matrix. Inside of the matrix, in that little microvacuole that I showed you, you have your glycosaminoglycans, which are these orange and green structures bound to proteins, and those glycosaminoglycans bind up sodium and water, and the water is shown as blue. And this is an example of glycosaminoglycans bound to a protein, and we call this a proteoglycan or a glycoprotein. So fluid in the tissue exists either bound up to these glycosaminoglycans or as free fluid. So fluid enters this tissue from the capillaries and it has to leave through the lymphatic vessels. If we knock out the lymphatic vessels, then fluid will accumulate here, bound to glycosaminoglycans, but also as free fluid. In lipedema, we know that the lymphatic vessels are functioning. Therefore, the fluid in lipedema accumulates here, bound to glycosaminoglycans. This is an ultrasound picture from Emily Eicher, Keaton Patel from California. And this is, you can see in the loose connective tissue here, there are all these dark lines and spaces. This is free fluid. If we look at the loose connective tissue in lipedema, you don't see that free fluid. You can't see the fluid bound up to glycosaminoglycans. That remains hidden to the ultrasound, but we can see this free fluid, and therefore you can see the difference between lipedema and lymphedema tissue. So for a cartoon of that, in lipedema, the fluid is bound up to glycosaminoglycans. In lipedema, the fluid is lymphedema, the fluid is also bound up to glycosaminoglycans, but also free. And if you have lipedema, you can progress to lymphedema. So lipedema appears to be in the spectrum of lymphedema. The proof that we have for this came from Shelley Krasinski at Vanderbilt University and her group, and she showed that extracellular water was higher in the loose connective tissue of women with lipedema compared to women that did not have lipedema. And these were women who were matched for age and body mass index. Shelley has also shown that the sodium content is elevated in the skin and loose connective tissue of women with lipedema. And we think that sodium is bound up to glycosaminoglycans. So where is this fluid coming from? With my former postdoctoral fellow, Sarah Al-Gadban, we found in the skin these unusual vessels. And these vessels should be horizontal here in the tissue, but they are, you can see they're upright in the dermis, approaching the epidermis of the skin. And these vessels are pathognomonic for an inflammatory condition. So we think there's inflammation involving these small vessels. And when we looked in the loose connective tissue, we found these conglomerations of multiple small vessels. And these small vessels were dilated, so we think that they're leaky, and they were sitting in a fibrotic background. So if these vessels and these vessels are leaking fluid into the tissue, then the lymphatic vessels could become overwhelmed, and the excess fluid would bind up to those glycosaminoglycans. There's some other evidence that there are leaky vessels in lipedema. This is an artery coming from the heart. The vessels get smaller and smaller down to the level of the capillary, and this is where fluid enters tissue. But there's also these post-capillary venules. If there is venous disease, so there's increased pressure in the veins, that pressure can translate back to these post-capillary vessels, and fluid can enter the tissue from here as well. So this is the region we think is of interest in lipedema. There are other things that can also cause leak from post-capillary venules, such as particular metabolites or cytokines, which are messages that are released from cells. So this is a picture of a capillary. It's surrounded by adipocytes here, and you can see there's this leak around the capillary that is entering the extracellular space or the extracellular matrix. When they looked at the capillary, they found it was thickened, suggesting that there was inflammation followed by fibrosis. And here's the post-capillary venule, and you can see there are areas that are dilated, suggesting that there's increased pressure in this post-capillary venule, causing leakage into the tissue. So what exactly is edema and lipedema then? So, or what exactly is edema? How can we define it better? So swelling of soft tissues due to increased fluid in the extracellular matrix. There's free fluid, but there's also fluid bound to glycosaminoglycans. You see both of these in lymphedema, and you see fluid bound to glycosaminoglycans in lipedema. So the question is, do external pneumatic compression pumps help with this new understanding of lipedema? And my answer would be yes. We know that lymphatic pump treatment improves lymphatic flux, so it's helping move that fluid out of the tissue. And we also know that hyaluronic and glycosaminoglycans, so hyaluronic is the most abundant glycosaminoglycan in that extracellular matrix, that all of these leave the extracellular matrix with increased lymphatic flux. So it makes sense that anything that you can do to improve your lymphatic pumping can help move those glycosaminoglycans out of the tissue. What else can you do to maximize your pumping? You can do things before you pump, such as whole body vibration, exercise. You can do a deep tissue treatment to try and break down that fibrotic structure. You can use gua sha or other tools to change the structure of the tissue. You can bounce like on a trampoline. You can do squeeze and release movements with your body as you would in yoga. And you can do the dead cat shake, where you lift your arms and legs in the air and you shake your tissues. And this has been shown by Indesign and Green to be very effective at improving lymphatic pumping. Once you get that gel kind of softened up and more in a liquid form, then you use your pump. And you follow that by wearing your compression garments or putting your legs up. External forces on the tissue can also improve the extracellular matrix. So there are cells called pre-adipocytes. They're not quite fat cells, they're like immature fat cells. And if you stretch them, then they don't go on to form mature fat cells. So instead, the tissue spends its energy on repairing and healing rather than storing fat. So these external forces can actually be stretching, like in yoga and other movement therapies, compression garments, pumps, swimming, and stretching. So I'm going to, with that new understanding of lipedema, I'm going to move on to the questions. So many of the primary care doctors here want to treat lipedema, but without a standard of care. They are very uncomfortable ordering labs. They don't understand and managing patients without a protocol. So 21 professionals met to discuss a standard of care for lipedema at the Fat Disorders Resource Society meeting in 2019. And the standard of care for lipedema paper is being written as we speak, and we are going to be submitting it for publication. We're also going to generate additional educational materials on a website and other much longer, extensive brochures. Because you can imagine it, you can't put everything you want to put into a single paper online. Number 2, can you discuss any labs that can be ordered for a person living with lipedema? So I would say yes. Most importantly, you want to assess for metabolic disease. So you want to check a lipid panel or blood fat, a hemoglobin A1C, looking for risk for diabetes, a fasting insulin and glucose level. And from there, you could do some calculations. We call it a HOMA calculation to determine the risk for developing diabetes. And you can monitor inflammatory markers or autoimmune markers, such as C-reactive protein and an ANA. And if these are present, you can try and figure out why. And the reason I'm focusing on metabolic disease is that we know that as women progress from one stage to another, if they do progress, or if they happen to be in a more advanced stage, then their body mass index is higher. They have more fat on their body and a greater risk for metabolic disease. And we published this data showing that as the stage increased, the body mass index increased, but so did the systolic and diastolic blood pressures, the HDL, or what we thought was good cholesterol, which now is our thinking is changing, but we'll look at it as good cholesterol right now, but that actually goes down with stage. And then even though very few women with lipedema develop diabetes, which is great, their risk for prediabetes goes up with stage. Question number 3, what is the single best thing a patient can do to prevent having to do surgery? Well, surgery, if we are thinking of it as suction-assisted lipectomy or liposuction, is medically necessary for a patient with lipedema for a number of reasons, and these include mobility issues and pain. Manual therapies, exercise compression, whole body vibration, sequential pneumatic compression pumps, all can help with pain and improve the tissue structure. But once mobility is limited and no additional fat can be lost by diet, exercise, or bariatric surgery, then liposuction is medically necessary to remove the fat tissue. So I think the single best thing you can do to prevent needing surgery is to maintain weight or lose some of the loose connective tissue. And that is where we need more research. How can we empower women with lipedema to reduce that loose connective tissue that is so resistant to diet, exercise, and bariatric surgery? And I encourage people to think about that based on what you've heard here today. Number 4, do you advise patients to shy away from bariatric surgery and pursue liposuction? In my opinion, if there's obesity fat or fat that's not lipedema and it's causing problems with blood pressure, blood fat, blood sugar levels, then bariatric surgery is an option. But bariatric surgery does not work well for lipedema tissue alone. So I think it's very specific to the person, and you need to be evaluated for metabolic syndrome to help determine whether you would benefit from bariatric surgery or a liposuction. Number 5, what are 3 best supplements that will effectively manage lipedema? So I will encourage you to check with your healthcare provider before starting any new supplement. Anytime you take a plant-based material and you put it into a capsule, it essentially becomes a drug, and there are side effects to all drugs. So as of today, it might change tomorrow, but my 3 favorite supplements would be enzymes. And these are enzymes that help you digest your food, like lipase, proteases. And you can get them from many different manufacturers. One of them is Wobenzyme, for example, very well known. And then there's other enzymes like serrapeptase or nattokinase. And nattokinase comes from natto, which is a food in Japan. And it's basically soybeans that are fermented with a bacteria, and that bacteria releases the enzyme nattokinase. So if you are having trouble with soy, nattokinase would not be the enzyme of choice for you. These enzymes help break down fibrosis, and they eliminate these little microvascular clots that can form in tissue that has stagnant flow, as in lymphedema. The only problem with these enzymes is they can cause increased bleeding, especially in people who have Ehlers-Danlos syndrome and very friable tissue. And so I recommend, if you are taking an enzyme, and usually you want to take these on an empty stomach so they are absorbed through the M cells, M as in Mary cells, directly into the lymphatic system, that you stop these enzymes at least 48 hours before any dental procedure or a week before any surgery. My second favorite supplement would be diazomin. And the reason is because diazomin is bioflavonoid, it's anti-inflammatory, it reduces inflammation, it normalizes smooth muscle contraction, and therefore it helps normalize the size of the veins, and also improve lymphatic pumping. And also vitamin D. And vitamin D is known to prevent the formation of fibrosis. So you definitely want to work with your healthcare provider to make sure that your vitamin D is within the normal range. And vitamin D is a fat-soluble vitamin. So the more fat you have, the more the fat absorbs the vitamin D, and the vitamin D is not available to work. So you may need a little bit more vitamin D than somebody else. And some people just don't absorb vitamin D well, so you'll need to get your vitamin D level checked in your blood. Number 6, have you prescribed or seen any success with the keto diet and lipedema with your patients? Yes. So many women with lipedema have tried the ketogenic diet and had very good success with weight loss. Some women with lipedema don't tolerate the ketogenic diet and opt for more plant-based or a variation of the ketogenic diet. Number 7, can compression that is too tight cause more issues? I have varicose veins and have been wearing 20 to 30 compression religiously for the last month or so. So that 20 to 30 refers to the strength of the tissue, and that's in millimeters of mercury. And so the answer is yes, compression garments need to fit correctly and not bind the tissue around the ankles, knees, groin, or other areas. So if you can get a good compression fitter, so someone who really knows compression garments and knows how to fit them on you and measure you correctly, I think that's really key, because they will work with you to find the best compression garment. If you have garments with Velcro, that adds the ability to adjust the compression level, which is good, so you can tighten them or loosen them during the day. And there are also inserts like sponges or things called swell spots that can help in unique areas like a cuff that can form at the ankle or the wrist. Number 8, I think my 5-year-old daughter has lipedema. How can I help her not end up stage 3 like me? I could cry. I mean, this is why we're doing this, right? We want to help ourselves, but we really want to help our daughters, our nieces, the next generation. So I think that there are things that kids can do. For example, trying to help regulate the processed carbohydrates. Processed carbohydrates make fat grow. So I think it's really important to educate kids, even if they continue to eat them, they just hear it and they learn that carbohydrates that are processed are not the best thing for me. I think getting them to wear a sport type or yoga type compression leggings, and they're so cool and popular today, why not, especially while we're all isolating during the pandemic. If you could, when the pandemic ends, get your daughters in for a deep massage on the legs and then learn how to do this at home, that would be helpful. Using hand rollers or foam rollers for the legs would be good to learn how to use early on, and you can make that really fun and do it to music, for example. If you have vein issues, your daughter might have vein issues, getting her evaluated early would be important, even especially as she enters puberty. And consider having her use a pump daily for even 15 or 20 minutes. Swimming, I think, is one of the best exercises that really helps move the tissue around and improve the extracellular matrix, getting those glycosaminoglycans out. And then whole body vibration and trampoline are also really fun for kids to do. And I think that also helps the structure of the tissue. Number 9, can you decrease interstitial fluid in the extracellular matrix? Yes. And I showed that pumps can do this, but I believe manual therapies, exercise can do it. But you can't just push it out alone. You have to change the structure of the tissue at the same time. So you have to push things out, but then you have to improve the health of the fibers, the collagen, the elastin. So I think enzymes help with that. Anti-inflammatory supplements like diazomin, liposuction can help. But I will warn you that one of the main side effects of liposuction is fibrosis. So you really want to be working with a manual therapist or know yourself how to treat your tissue after the liposuction to reduce the accumulation of that fibrotic tissue. I think maintaining weight is super important, or being able to lose weight is great. And then deep tissue therapies of all kinds. Number 10, does treatment for someone with both lipedema and lymphedema differ? Well, yes and no. So I think the compression level is going to be higher if lymphedema is present compared to just lipedema. And wrapping may be needed for lymphedema in addition to manual therapy, whereas wrapping may not benefit someone who just has lipedema alone. I think weight loss helps both, pumps help both, eating healthy is important for both, and exercise is important for both. Do lipedema patients need to avoid hyaluronic acid in skincare products? So hyaluronic acid or hyaluronin, they're both the same thing, is the most prevalent glycosaminoglycan in the extracellular matrix. And we talked about wanting to move that out of the extracellular matrix. But as we age, we lose hyaluronic acid or hyaluronin in our skin. And so a skincare product that has hyaluronin in it will help supplement the loss of that hyaluronin from the skin. And I see absolutely no problem with continuing to use it. Question 12, should we limit sodium intake? So we talked about those glycosaminoglycans binding up water and sodium. So the question is, should we reduce the amount of sodium we take in to reduce the amount of sodium bound to those glycosaminoglycans? And I think the answer is yes. So try not to add extra salt to your food. So this means you are going to eat less processed foods, because processed foods have a lot of salt. And when you're at home, just try not to use the salt shaker at the table, or use some salt substitutes that don't have as much sodium. And this does not apply to people with very low blood pressure, with neurogenic hypertension, or postural orthostatic tachycardia syndrome, who take salt to help their disease. So if you have any of those or know someone who has those, you can ignore what I just said. And the reason is people with Ehlers-Danlos syndrome can have autonomic dysfunction, and you can look that up in the paper that I'm showing, and therefore may need to take salt and other medications to keep their blood pressure stabilized. We do have some evidence that low salt diets do reduce glycosaminoglycan. So if you increase the amount of salt you take in, this increases the amount of fluid coming out of the capillaries into the extracellular matrix. And that in turn, that fluid and sodium stimulates the production of glycosaminoglycans. Number 13, what is the ICD-10 code for lipedema? So lipedema is found in the US ICD-10 index linked to R60.9 for edema, and we think that's inadequate. In Germany, they have codes, E88.2 codes, coding for lipomatosis, and that means fat on the body that can't be lost by diet or exercise. And I think that's a more appropriate code for lipedema. So we wrote up a change to the US ICD codes and submitted it on June 12th to the Center for Disease Control. And these new codes will be reviewed You can actually go to the CDC website when they open up the codes for comment and make comments on it. And we anticipate if everything's approved that these codes will be available in fall of 2021. So it takes a long time for them to get there because they want to be sure that they are good and correct. So number 14, would you also recommend deep fascia massage to help break up some of the fibrosis? Yes. I don't know why it says should we limit sodium intake. Sorry about that. But my answer is yes. So deep tissue manipulation reduces fibrosis, reduces fat, reduces leg volume, and improves quality of the tissue. So we did a study on 7 women with lipedema and did some deep subcutaneous adipose tissue therapy, which is a different name for quadrivus therapy, which is based out of the Netherlands. And we looked at ultrasounds and we found these nodules in the tissue. These are probably some of the nodules that we can feel on the surface. And you can see that this particular nodule is actually a blood vessel. So there's probably inflammation around the blood vessels, as I mentioned earlier. And after we did the deep tissue therapy, all of those vessels had normalized and we were not able to find them anymore. So that's a good thing. So we improved the health of blood vessels by doing deep tissue therapy. We also looked at the fascia, and you can see that there are these broken lines in the fascia of women who have lipedema. We think there's fluid in the tissue, and again, it may be a change in structure of the tissue. You can see it just doesn't look linear like it should. And after the therapy, you can see we restored these lines back to a more normal fascia phenotype. So I think the deep tissue therapy helps the fascia and it improves the health of at least blood vessels. So can deep tissue therapy like quadrivus heal blood and lymphatic vessels? So the answer would be yes. Number 16, I had complications from lipedema surgery and now have stretching of skin and fibrosis. It feels like skin is totally being pulled. Do you know how I should follow up or avenues to take? So it sounds like there was the development of fibrosis after liposuction, which is common. And I think going to a good therapist who knows how to do deep tissue work and improve the tissue structure would be very important at this time. And I think that if you do get liposuction, you really need to be working with a therapist prophylactically. It would be better to have him or her work with you right after the surgery rather than waiting until fibrosis had actually formed. Number 17, how much volume can fibrosis take up? I've heard Dr. X say it could be a layer 1 centimeter thick. Would it be possible to diminish circumference by diminishing fibrosis? And the answer would be yes. Fibrosis is the excessive deposition of extracellular matrix. So this is a paper of a patient who had lymphedema. And there are no papers like this for lipedema, but I think it tells us a little bit more about the tissue. So here on this axis, you can see subcutaneous thickness, and this is skin thickness. And then this is stage of lymphedema. So as you progress in stage, the lymphedema gets worse. And you can see that the thickness of the tissue increased with stage, and this reached about 2.5 centimeters. So I would say even greater than a centimeter thick for fibrosis. And the skin thickness reached up to 4 millimeters, so almost half a centimeter, which is very, very thick for skin. You can see normal skin is down here around a millimeter. So yes, I do think that fibrosis can increase thickness of the tissue, and manipulation of the tissue using manual therapy and pumps and compression garments all can help reduce that fibrosis. And this, I found this yesterday and I decided to throw it in. I think there's a lot of different modalities on the market that can help reduce fibrosis in tissue. And this is one example of that. So this is far infrared radiation thermotherapy. So it's basically a device that's applied to the leg, and it actually heats up the leg, and then they used far infrared radiation to reduce the fibrosis. And people who had this treatment found that their circumference was reduced, their skin elasticity improved, the amount of fibrous and dense material in the affected tissue reduced, and the patients actually felt better. Their symptoms of tightness, heaviness, pain, discomfort, and even numbness improved, and they felt their quality of life improved. So things like lasers and far infrared therapy may be something to look at and research and see if it might benefit you, as long as you understand the side effects associated with the tissue. Number 18, why does lipedema worsen during menopause if in this period feminine hormones decrease? Well, the reason is that lipedema develops not only during times of hormone change, so puberty, pregnancy, menopause, but these are also times when we are gaining weight and our shape is changing. So any weight gain, except for gaining pure muscle mass, is not good for lipedema. So the development of obesity or obese fat worsens lipedema, and lipedema can increase the risk for development of obesity. Number 19, I have been diagnosed with lipedema stage 2 and Derkham's disease. I tried to swim a few times, but when I get out of the swimming pool, I feel my legs are even heavier than before and painful. Why is that? So I thought long and hard about this while I was in the pool yesterday. And I think that if you have lipedema and Derkham's disease, there's a lot of pathology going on in that tissue. And if there's a lot of scarring, the loose connective tissue moves a lot in the pool, which is why we find swimming so beneficial. But if there's a lot of scarring, that tissue can tear and become inflamed when it's moved in the water. So a pump may be useful to use after you get out of the swimming pool. I was also thinking you might feel lighter in the water and heavier when you return to land. But I think just improving the tissue structure would be really important to do, perhaps even before you get into the pool. So maybe even pumping before you got into the pool.
And I want to say thank you, Dr. Herbst, because that was a rapid fire going through a bunch of really good questions. And we have a host more live that have come in. So if you don't mind, let's get to it, okay?
Sure.
We have got a question from Joy Barnett speaking about the hormones. Since lipedema seems to be hormonally driven, why isn't it possible to treat by getting the hormones in balance?
There's really been absolutely no research on hormones and lipedema. So that's something that needs to be done. I think, having normal hormone levels is a good thing, but, women's hormones are really complicated. So your estrogen and progesterone levels rise and fall throughout our cycle. So what actually is balanced and normal, especially when you're not cycling anymore? And I have seen a lot of ladies with lipedema who are on the birth control pill, and they're on very low dose, and it really has not exacerbated their lipedema. Now, that's just an anecdotal report. We really need research on women with lipedema before they start birth control and after, to really figure out whether that's a good thing, and whether a woman entering menopause should start on hormones. And currently, it's recommended you start on hormones and menopause only if you have symptoms. So I really just think that more research needs to be done, and I would love to be involved in that.
Yeah, I know that your plans are to research, and we're so grateful. In fact, a lot of the comments that came in were simply thank you, Dr. Herbst, for what you're doing to raise a banner and do the research and educate. And so this question goes along with that from Chris Wolfel. Dr. Herbst, why can't we get other physicians to understand and accept this disorder? It seems like there are so few physicians who know about it.
Well, I think the standard of care will go in, the U.S. standard of care will go a long way to helping raise awareness of lipedema and provide some instruction on how to take care of patients with lipedema. So that's really on the top of my list to get done. And we're very excited about it and very hopeful. And, you know, we're working really hard to make that happen. When it does, we will be posting it everywhere so that I think healthcare providers will start to take it up because they'll have guidance on how to do it.
Yeah, wonderful. So we don't diagnose on webinars, but we do have some questions that people have about their own particular condition. Like Janelle Miller asks, is it possible to have lipedema around my inner thigh and behind my knees, but also have metabolic syndrome from eating too much sugar and bread and French fries?
Yes. So you can have both lipedema and metabolic syndrome. And I think if you improve your eating, then your metabolic syndrome will also improve and your lipedema in turn should improve. But if you've already built up some structure in the tissue, you're going to have to do some manual therapies and other things to improve that structure.
Good. And we also addressed the question about supplements. I found that to be really interesting. And I actually was taking photos of your screen so that I could make sure I'm getting enough vitamin D. Absolutely. We have another question now. Today's webinar is sponsored by Lympha Press. I have to say it makes me so proud that Lympha Press has the only pneumatic compression pump cleared by the FDA for the treatment of lipedema, which is the Optimal Plus. We have a question about pumps, not a Lympha Press. Someone said that they used a competitor's pump and they experienced significant breast pain. They're trying to sort out if that pain was related to the pump or strictly hormonal, and are there any instances of the trunk portion of the pump creating congestion or pain in the breasts?
If the pump doesn't treat the breast at the same time, and I don't know if you have lipedema or lymphedema, but if the pump is not treating the breast at the same time, then fluid is going to move through that extracellular matrix to whatever region is not being pumped. So it might be a good idea to talk to your rep and have them either adjust the compression garment or the pump garment, or consider putting a swell spot over the breast. So some extra pressure so when the pump is pumping that the breasts also get treated.
Excellent. This participant today, Heather Armstrong, you had a 4-point question. We're going to try to get to all 4 points. Her primary care physician wondered if cool sculpting might be an option, as it would seem to be less risky to the lymph system than water-assisted liposuction. Or is there more of a risk of paradoxical adipose hyperplasia for lipedema patients? Cool sculpting.
Yeah, so I think somebody needs to do that study. Somebody may already be doing that study for cool sculpting for lipedema. And I was reading about it and thinking about it, and I think I need to read more. But my understanding is that it's really geared towards killing off the fat cells. And so you kill off the fat cells, that's great. But you are going to generate some inflammation because that's part of repair, and what's going to happen to the tissue structure. So I think you can't just do cool sculpting. You have to combine that with some sort of manual therapy or care from a therapist to ensure that the health of the tissue remains and that that additional fibrosis does not form.
Excellent. As I go to the next question, would you mind not sharing your screen anymore? That way we can see your face better. And I think everybody wants to connect with the renowned Dr. Herbst. So that's perfect. What about CBD oil? Is that, are there any known harmful interactions if you use CBD oil for pain?
Not that I know of. I think a lot of my patients use CBD to sleep, to reduce their pain, to relax. So I so far have found no problems with CBD. The only thing I will say is that there's different concentrations of CBD. So you might buy one that's not very concentrated and it may not be as helpful. So I think, making sure that you research the type of CBD that you use would be really important.
Excellent. Many people out there want to follow you and your career because you are the champion for the lipedema patient. They wanted to know what your plans are for the future.
So I am going to continue doing research.
Yay.
And I am going to start a private practice, and I'm working on three different places. And as soon as I get up and running, I will definitely let people know.
Excellent. We'll all be watching. Penny Prasuti asks, do you have any doctors outside of the United States for liposuction that you would recommend?
Ooh, there's a lot of them, actually. There's a lot of, in the UK, in Germany, in Italy, and Sweden. And so I don't think it would be a great idea for me to just say names in particular right now. But I think word of mouth is really important. Yeah. There are a number of Facebook groups just geared towards liposuction for lipedema. And I think it would be really important for you to research the physician that you ultimately choose. And I think you need to listen to other women who have gone to surgeons and the experiences that they've had.
And it's remarkable. Dr. Google knows so much, Dr. Herbst. I've been talking to lipedema ladies, and they are voracious researchers and their own advocates. And the information is there, and they are scratching and clawing to find it and to figure it out. So it's out there. You can find what you need. Go ahead.
You can. And I've learned a lot from patients who have lipedema and Derkham's disease and other loose connective tissue disorders. So I appreciate that, and thank you.
So what do you think is the most effective treatment for lipedema fibrosis? Is there a way to safely break it up? And you did mention that in your presentation, but just a reminder for Mary Caldwell.
Well, everybody's different. So a tool that one person uses may not be the right tool for somebody else. So, and I think having a therapist who knows how to do deep tissue therapy would be a great resource. And those therapists may not be, for example, lymphedema therapists. They may be a regular physical therapist, occupational therapist, licensed massage therapist, and they've taken additional courses in deep tissue treatment. There are techniques such as ASTEM therapy, which is a tool-based therapy to break up fibrosis. I've had a lot of ladies with lipedema do that. They find it to be very painful, but they feel really good after they're done. There's also the Graston technique. That's another instrument-assisted soft tissue therapy. I've had some patients do that, and it's very similar. It's a steel tool versus a plastic tool. And then there's Chinese practitioners who use the gua sha tools. And in fact, Andrea Brennan, who runs a Casely Smith School for care of tissue, uses gua sha tools when she treats patients. And then there's the handheld rollers, the fascia blasters, the foam rollers. So there's all sorts of different ways to do it. And you can try different things. It would just be great to have somebody working with you to guide you.
Excellent. Can diet ever reduce the size of the lipedema nodules, or is liposuction the only way to remove the diseased tissue?
So I think, I don't think there's like one thing for lipedema, like do this, you're done. I think there's combinations of things that we need to put together to help that lipedema tissue go away. So a good healthy diet that brings your non-lipedema fat down, super important. And then using some of the manual therapies or other tissue therapies to improve the tissue structure. Because if you can improve flow through the tissue and reduce inflammation, you should be able to reduce that lipedema tissue. And I would love to see more medical therapies used to reduce lipedema fat versus liposuction. And that is what I hope to focus on. So, and maybe you'll figure it out. So let me know.
Yeah. So Mary Caldwell also had a doctor tell her that Derkham's is just another form of lipedema. What are your thoughts on that?
I don't think that's true. I think that they are very different, and there's also different types of Dercum's disease. And if you want to refer that physician to a good resource, they can go to endotext.org. So it's endotext.org. And there's a section on obesity. If you click on that, you'll find my chapter, and it's free to download. And in there, it talks about the different types of Dercum's disease, and it also has a very large section on lipedema. And I think if they read that, they would understand the difference.
Perfect. Great resource. Julie Ellis has a mass or lobule on her thigh. What is your take on debulking to try and help mobility in lipolymphedema?
So that's a great question. And in fact, there's a paper published on liposuction for advanced lipedema. So if, I would recommend that you read that paper. And again, it's hard for me to just recommend it generally because I need to see the person. And I think whatever you do, your healthcare providers have to think about you and what's going on with you to make sure that as you go through this process, that you're as safe as you possibly can be and get the best out that you can possibly get. But lobules are concerning because lobules are forming and hanging down with gravity, and fluid moves down with gravity. And so lobules tend to get bigger over time. And therapists, manual lymphatic drainage therapists, can reduce the size of lobules and provide compression garments that can contain those lobules. And there are now compression garments specific for lobules. So I think getting to a therapist and making sure that as you make your decisions that your lobule doesn't increase in size is really important.
So here we are entering into these hot summer months. Question from Penny Pursuti. What makes heat one of the worst culprits for swelling?
Okay, so heat causes swelling because your vessels dilate. When they dilate, they're more likely to release fluid into the tissue, into that interstitial space, and bind up to glycosaminoglycans. So, and I know that compression is really difficult to wear in the heat. I live in Arizona, and we're looking at 106, 109 temperatures here, and it's super hot, and I'm wearing shorts. So, I think in that case, wearing compression while you're inside in air conditioning, so that you can tolerate it. Make sure that you can swim if you can. That's really important. And you're going to do the best you can. And Velcro wrap may be helpful so that you can try and contain that swelling. And then there's other compression material out there that's more breathable. And so I think asking your compression supplier, what can I wear and not die in the heat would be really important to do.
Great question.
Use your resources, but again, I don't think there's a great answer at this time. We need something that cools while you wear, like icy compression.
Yeah, so someone needs to create that, and let's go on Shark Tank and get it made.
Yeah, let's go on Shark Tank.
So
right.
Here's a question from Estelle Warden, and this is a great lead into some other questions we had about Lympha Press itself. So I'll give you a break for a moment after this question, and we'll go to Eric Ansart from Lympha Press. But does pumping break down the fat so it can be lost, or does it only address the swelling of lymphedema?
So I think pumps serve a dual purpose. So they do help move fluid, like free-flowing fluid out of the tissue, but they also move that interstitial fluid bound up to the glycosaminoglycans out as well. We need to study the pressure and the lipedema structure and figure out how to better improve the health of the structure. I won't say break it down, because break it down just sounds like you just chop it up and everything's going to be better. But I think improving the health of it so that the collagen and the elastin fibrils are healthier and allow better flow through the tissue is really important. And we were just talking about that this morning, and we hope to be working on that soon.
You're going to be very busy because you're going to be working on a lot of different things, and we're so thrilled that you are. I'm going to call Eric back to the screen if you're there, my friend. Eric is the president of Lympha Press USA, and we did have some questions come in prior to the presentation. One was, what is the best Lympha Press for lipedema stage 3, no lymphedema? Could you answer that for us, Eric?
Sure, I'd be happy to. First off, thank you so much, Karen, for the presentation today. And I'm so glad to see so many people on the call today. I mean, this is Lipedema Awareness Month, and I think just really taking the time to have these discussions is so important. So when we talk about stage 3, from my understanding, and every time I listen to Dr. Herbst speak, I pick up quite a bit more, is, you know, we're dealing with lipedema that's primarily surrounding the hips and the thighs. And I think when we talk about what device to use in that situation, the most important part is making sure that you have a garment that covers the affected areas. So we want to make sure that you're using one of the pants garments, which would cover the inner thigh, the thigh, and as much as the hip and the abdominal area as possible. We do have kind of our flagship product that Brenda mentioned earlier. Our Optimal Plus is FDA approved for the treatment of lipedema. And ideally, we always want people to use the best equipment for the situation that's, you know, they're dealing with. A lot of times, as you know, insurance and reimbursement plays a factor in some of those things. So we've taken a lot of the technology within Lympha Press and tried to move that technology and driven it into a lot of our different products so that patients have options when it comes to what their insurance company will pay for, and if they're out of pocket, you know, expenses, you know, things like that factor in. So the most important part, to get to your answer quickly, is really just make sure that those areas are covered if possible, so that you have a garment that covers that. We have 16 and 24 chamber garments that'll cover that entire area. That's what we would ideally want to make sure that you're using. And then if we can, then we'll put you in the best products, because you have the most flexibility and versatility in the product to change cycles, pressures, features, all of that, to kind of really meet the need of what you're looking for.
You know, we have an international audience today, and we're so glad that you're all here with us. Thanks for sticking in there. And we're going to keep Dr. Herbst here as long as we can, so we'll get to more of your questions. One of the questions was, how do you get Lympha Press in Canada?
So that's a great question. Canada has actually changed some of their importing rules over the course of the last 12 months. So probably the easiest way, if you're looking for a Lympha Pressing in Canada, we had one provider that distributed throughout the entire country. We're only really talking about US coverage right now from my place, but I say call us. Just give us a call. We'll make sure that we can identify a way for you to get the product and get taken care of.
And of course, everybody's asking, will I get this presentation afterward? And yes, tomorrow, anybody who registered will get the link to the presentation, as well as some other helpful links. We can certainly connect you to Lympha Press and make sure that we can service you wherever you are. How long, Eric, do you recommend that a lipedema patient without lymphedema use compression and the pump if no noticeable reduction is taking place?
So I'm going to answer this from my perspective, and I'll defer to Dr. Herbst here if she thinks otherwise or has something to add to it. But I think reduction is really only a piece of what we're trying to aim for when we're talking about using a pneumatic compression device. So, you know, Lympha Press, our goal is to increase mobility, you know, to obviously to create some reduction if there's lymphatic fluid or interstitial fluid that we can move out of that area, and also to help manage some of the pain. So really depends who you're talking to, and I think every patient has different experiences, but I'll remember or kind of reflect back on a conversation that I had at the ILF conference in Chicago last year. And in speaking with somebody about their concepts of how pneumatic compression plays into lipedema specifically, the physician said, I believe it really allows the patient to increase their mobility, decrease some of the pain, and then they become more adherent or more capable of doing a lot of the other therapies that come along with it. So there's so many aspects to that, and it's hard to manage or answer that question directly. But I would say, let's look at what your goal is. You know, if the goal is strictly reduction, then, you know, let's use it ideally for at least a month or so. I tell patients all of the time, this isn't a condition that happened in 30 days or, you know, a month or two. It took years. So let's give the product some time to work and give it a month, give it 2 months of regular use, 1 to 2 times a day until you understand what's happening and you can see what's taking place. And then you can go into more of a maintenance mode after a period of time.
That's so true. I've been doing a series of interviews with lipedema ladies, and you can go to the Lipedema Ladies YouTube channel. And they're all shapes and sizes. I interviewed a woman who was 5'8" and 140 pounds. And she has an Optimal Plus for use pantsuit and upper extremity. And it wasn't about reduction for her. It was all about reduced pain and mobility. Exactly what you just said there, Eric. So that's excellent.
Well,
you know that, go ahead.
Let me just mention one other thing here. And I think to Dr. Herbst's point that so much of this still needs research, but last year we did a study in Israel, which is where the product's manufactured. We did a study there with the use of our device where we provided a sustained pressure over an extended surface area to see what would happen with patients who had discomfort or pain. And the interesting thing is that the pain receptors, or from my limited knowledge, it seemed to change the impact, right? So the patients didn't feel the same level of pain that they felt originally. Now, I don't know how that plays into lymphedema or lipedema for most patients. That may impact some patients differently than others, but I think there is something there to say, you know, we can hopefully help that component of pain. And then, boy, I know what it's like to be in pain. And we talked at the very beginning of this meeting about hope. That's a very hopeless place to feel when you're stuck in a painful, chronic, painful situation. So if we can alleviate even one aspect of that, it's a tremendous success and opportunity.
Well said. So going back to this, not your, you know, you have a mental image of perhaps what lipedema looks like, but it really comes in all shapes and sizes. And Dr. Herbst, one of the people out there asks, why does this condition progress if my weight is normal?
So I think I just want to reference back to what Eric said, that, and also Brenda, what you said, that when you are reducing, especially you're reducing your weight, what remains the longest is the fibrotic tissue. It takes the body a lot longer to heal fibrotic tissue than it does tissue that's not fibrotic. So someone who's tiny, and I've seen, you know, very, very tiny women who have lipedema, but if you feel within their tissue, they have that nodular fibrosis. So I think that what that woman is experiencing is fibrosis within her tissue. And that is why it is not going away by diet, exercise, and healthy living.
Yeah.
So we got to figure that out. We have to figure out how to reduce the fibrosis so that we can, you know, make many, many people happy and, you know, improve quality of life. And it not only, you know, patients who have lipedema, but anyone with fat that has fibrosis in it.
Absolutely.
And like, for example, a lot of patients with Ehlers-Danlos syndrome develop fat depots that can't be lost by diet or exercise. And that can happen just on the abdomen. And so I think that's kind of a similar pathophysiology going on. And a lot of women with lipedema have hypermobile joints or Ehlers-Danlos syndrome. So I think we can, you know, we need to look outside lipedema into obesity and into Ehlers-Danlos syndrome and find out what they're doing for fibrosis. There's also a lot of studies going on fibrosis in the liver, fibrosis in the lungs, also congestive heart failure. Anytime a person develops edema, they bind up more water to glycosaminoglycan. So what can we learn from all these other diseases and disorders and bring it back to lipedema?
That's well said. And here's a follow-up question about muscle development. How does lipedema affect muscle development during resistance training compared to non-lipedema athletes?
So there hasn't been a lot of work done on the muscle and lipedema, but by ultrasound, what we find is that the muscle becomes more fatty. So more adipose tissue is in the muscle in the later stages of lipedema compared to the earlier stages. And that means that extracellular matrix is also affected in the muscle. So it's like a cage for the muscle, and we need to let the muscle out. And the only way to do that is to do deep tissue therapies to help improve the health of the tissue. So you're right, it's not just about the fat, it's about the muscle as well.
And you, yeah, and you asked, you covered this in your presentation, but here's another component, because you said it's not one size fits all. For some people, keto works great. For some people, a plant-based diet works great. It's, again, very individual. Here's a question about intermittent fasting and lipedema. Do you have any thoughts on that?
Yeah, so I have seen some of the best weight loss in women who have, eaten low carb, whether they're doing it plant-based or keto, and combine that with intermittent fasting. And what we know is that in tissue that is not healthy, and by not healthy, I mean that it's metabolically not doing very well, like lipedema tissue. In lipedema tissue, there are very big fat cells, and that is a marker of a metabolically changed environment. And it's very similar to what you see in, for example, tissue from people who have diabetes. So in that tissue, there are these cells called senescent cells. And these are cells that are not really quite alive, but they're not quite dead yet. And so what they do is they just secrete a lot of inflammatory molecules into the environment and just make it worse. So I think one of our goals would be, we need to get rid of those senescent cells from the lipedema tissue. And the most impactful treatment to get rid of senescent cells is intermittent fasting.
Wow.
So it's definitely worth doing. And then the question is, well, what kind of intermittent fasting that
was my follow-up question. Because, there are some people that will do it for a whole 24 hours. Then there's the 16-8 version. Do you have any? I'm taking copious notes here.
Yeah, I don't know. I don't have a good answer. I think it has to be personalized on what a person can do. And you have to see how you feel. If you can fast for example, 16 hours. So you eat during that, 8 hours a day. I've got women who only eat during a 4-hour period. I have others that only eat during a 2-hour period. And they have figured out that they feel better based on a specific length of fasting. So I think if you read about intermittent fasting and just start slow and, fast for a short period of time, a couple times a week, and then fast for a longer period of time, a couple times a week, and then increase it to 3 times, 4 times, and just really listen to your body. And when your body says, God, I feel like amazing, then you've hit the nail on the head, and that's a pattern of fasting that you can follow.
I think if I was eating 2 hours window in a whole day, I'd be like, my body feels hungry. I would feel like the Cookie Monster wanting to shove things down my throat, but that's not the way you do intermittent fasting. You don't shove everything down your throat in 2 hours.
No, but they eat a big meal, during that 2-hour period. That's their meal. They eat, a plate of vegetables, and they might eat, a piece of meat, and maybe even a healthy type of starch, and then that's it.
Okay. Well, this other
That's
question.
not for everybody. I couldn't do it either. I could not do that, but they have figured out that works for them. And that's why I don't think you can say, hey, how do you fast? Because that's exactly what I'm going to do, because you might feel horrible, right? So you've got to you got to read, research, and listen to your body.
That's the best advice, because it really isn't you can't just say, this is what's going to work for everyone. A question came in about the Optavia MetaFast plan. Again, it's listen to your body and see what's producing results, unless you want to say anything specifically about that diet.
I don't like diet. I don't like
me either.
You do something dramatic for a short period of time, and then you stop and you go back to regular eating, and then you gain weight back. I just don't think that's good. I think you need to find out how to eat for your body and what makes you feel really good, and then stick to it. And that's it. That's it for you. And you're going to make modifications as time goes on and we learn, you know, more things, or you hear something that you didn't hear before. But if you do the yo-yo thing where you lose a bunch of weight and then you gain it back, your body starts to want to hold on to the fat because it says, oh, you're going to lose fat. You're going to go into a famine. This is really bad. I'm going to hold on to my fat as tightly as I can. So it's more than just about the loose connective tissue itself. It's also how your body regulates how much fat it keeps on the body. And that's based on hormones and nerves and other things. So it's kind of complex.
Yeah.
But again, a stable eating plan that you stick to and you feel good doing. If you feel terrible, it's not the right plan for you.
Yeah. I wish we could see the videos of the many people that are listening to you right now, nodding their heads and saying, yeah, I've tried everything. I've done it all. I did that diet. And then to have lipedema, meaning no matter how you diet, diet and exercise doesn't make it go away. And that's why I feel like we have such compassion for these patients at Lympha Press, because we have people that have done the yo-yo thing and understand what it means to have that fat shaming scenario and the up and down. And so it's not just about the products that we can provide, but our hearts are invested in helping these patients. And so that's why we really appreciate your help here answering these questions. Can you speak to the benefit of a tummy tuck? Asks one person.
So again, that's a very personal question. It really depends on what your body shape is and what you have going on. But I have seen women with lipedema who have had tummy tucks, and it doesn't feel like they have any lipedema tissue left on their abdomen. And you can get lipedema tissue on the abdomen. And I just can't, it's not something that I truly recommend unless they have a panniculus. And a panniculus is a big hanging fold of tissue that comes off of the abdomen and pelvic area. And when that happens, again, gravity's not your friend. Fluid flows into that panniculus and it grows a abnormal structure, and it becomes full of fluid bound up to glycosaminoglycans, and it becomes heavier and heavier and heavier. And that's not good, because that can actually limit mobility. It can cause pain. And in that sense, I do recommend tummy tucks for women like that. So I hope that helps. But again, I think that's a very personal question.
It is.
You need to speak to a healthcare provider and see what they think.
Absolutely. You did cover the importance of vitamin D. And Doris Lang asks, when someone is tested for vitamin D levels and they have lipedema, is the vitamin D stored in fat cells giving false levels?
No, because you're measuring vitamin D levels in the blood. And so everything's coming into an equilibrium. So the amount of vitamin D in the blood is coming to an equilibrium with the vitamin D in the fat. And the fat will just keep sucking it up until that equilibrium is reached. And so your blood level is definitely reflecting on the amount of vitamin D that's available for use outside of fat cells.
Gotcha. Questions about the enzymes that you mentioned. When should they be restarted after surgery?
I think you want to make sure that your blood levels are within normal limits, because you can develop a mild anemia after liposuction, and it takes about 30 days for blood cells to really come back. So I would say I would wait a full month before restarting. But again, if you have a really low hematocrit or hemoglobin, then I wouldn't restart until that has actually come back into the normal range. So if you can get that checked and it's back to the normal range, then I think it would be okay to go ahead. But you want to monitor for excess bruising. Like, are you getting more bruising now after the liposuction, taking the enzymes, and is that causing problems? Should you stop it? So I think a good discussion with your healthcare provider or your liposuction surgeon would be good.
We want to be really respectful of your time, Dr. Herbst, and I'm hoping that we can squeeze in these last 10 minutes so we can stop at 2 p.m. Are you okay with that?
I'm okay with that.
Oh, and there was a collective cheer in the audience. So let me zero in on some questions here. I've heard this from more than one lipedema lady. Mucinex. This woman just started Mucinex daily and she can feel a difference. Do you recommend this tip? And again, we know it's not one size fits all, but Mucinex.
Yeah. So that's really interesting. So mucin is another word for glycosaminoglycan. So taking Mucinex actually makes the glycosaminoglycan water sodium mixture more liquidy, and that means that it would have a better time leaving the tissue.
Oh, wow.
And some women with lipedema respond to the Mucinex and some do not. And that just puzzles me. Why is that? And is it that the women who respond better, do they have more glycosaminoglycans? And do the women that don't respond have more fibrosis? And I wish I knew, and I wish, you know, there was some easy way to monitor fibrosis. There was a recent paper that came out where they were doing CT scans to monitor fibrosis, and I was, you know, I was interested, but I wasn't very happy because CT scans involve a lot of radiation. I'm not a big fan of that. Why would we want to do that? You know, give radiation to the legs of ladies with lipedema over and over to monitor fibrosis. It doesn't make sense. And I wish ultrasound worked. And I was speaking to an ultrasound rep yesterday, and I was saying, can't you help me quantitate fibrosis in the tissue? Because then we could, you know, figure some of these things out. And we just don't have those answers yet. I think MRI works really well. But that's really expensive, and they did have come out with a portable MRI. And I know that's a long-winded answer, but wow. I think Mucinex does work well for some ladies with lipedema. Diazomin works well for some and not for others. So, you know, it may depend on what's going on in your tissue and your genetics. And, you know, if we could figure that out, that would be great. So, and there's also more. I just saw there was an herb. I can send it to you, Brenda. I just, you know, I get these emails about different herbs, and I saw that. I don't usually look at them, you know, a lot because I just don't have enough time. But this one, something said, look at that one, Karen. So I looked at it, and it was again another mucolytic type of herb that I had not heard of before. And I can give you the name of that because that might be an alternative to taking a medication, because the Mucinex can get expensive.
Interesting. Wonderful. Well, I'm connected with these lipedema ladies. Whatever you give me, I'm going to give to them. And I think that's a really interesting idea because many of them don't want to take medication. They want to do natural methods to manage their condition. That's why so many of them love the Lympha Press compression pump. And this next question is about using the pumps. Can they lie down or do they need to be in a sitting position? I think that depends on which garments they're using, correct?
I would say that would be correct. And I think you know, you really want flow to happen. So the best way to do it would be to be lying as flat as you possibly can, because if you're bent in the pelvic area, then you're going to be pumping into that bent area, and right where your leg bends and meets your pelvis, that's where there's a lot of lymph nodes. So I think making sure that you can get that angle just to open up a little bit, that would be helpful. And if you only have the leg sleeves, so that go up to the top of your legs, you want to make sure that when you pump that you are wearing like a bike short, high waist bike short type of compression to allow that fluid to move out of the pelvis and abdomen and into the vessels, so that you're not just piling fluid up into your belly. And you can even wear like a neoprene binder. You can get them from all sorts of stores, including sports stores. They're about $20, and you can wrap that neoprene binder around your abdomen to protect it. So fluid doesn't just move through vessels, it moves through that extracellular matrix. And it does in two forms, as you now know, bound to glycosaminoglycans or as free fluid. And so that's just a different exit route. So you can see how you could just push that from one region to another and just let it sit, which wouldn't be great.
So there is a lot of interest around FIRT, the far infrared radiation thermotherapy. I think a lot of people may have heard about this for the first time today. And is there a particular device that you would recommend? And Mary Caldwell says she's desperate to find something that will help with the pain. We feel your pain. And we thank you for asking the question, Mary. Any FERT recommendations?
So I don't. That's actually very new to me. As I mentioned, I just saw it yesterday and I got excited about it and I thought, I'm just going to share it. But there are things like cold laser, or there's far infrared saunas. So I think there are different things out there that can help with the pain. The one thing that I've noted about the far infrared saunas are that you don't want to do too much at a time. So if you go in 15 minutes and you feel a little bit better, then doing it for 2 hours is not necessarily good, because it basically puts you into a detox state and you may get overloaded. And I had one patient who just fell in love with it and went every day and ended up in the emergency room because they got really sick, just because their body could not handle all of the toxins that were being released from the tissue. And that's all that, all that gook, so that glycosaminoglycans and the other stuff that's just stuck in there. So I would just be whatever therapy you use, be very careful, try it out, go slow and increase slowly, and make sure that you're being monitored and that you're not just going to a place that's doing it and just leaving you and not really monitoring you.
Is there a connection between lipedema and angioedema?
So angioedema is different, but it also causes an edema, and it's a over responsiveness of the body causing swelling. And it usually happens around the lips, but it can happen in other parts of the body. And I know some ladies who have angioedema and also have either lipedema or Derkum's disease. And that's something that they have to fight in addition to their connective tissue disorder. So, and then you have to avoid all the triggers that cause the angioedema. So I think looking for all the triggers and then making sure that you have a connection to a healthcare provider, because a lot of times they need to take epinephrine. Their swelling could actually close their throat. So angioedema can be very dangerous.
Irritable bowel syndrome, is that a comorbidity of lipedema stage 4?
So when you say lipedema stage 4, I'm assuming you mean that lipedema stage 3 with lymphedema, and we call it lipolymphedema. We're trying to get away from stage 4, just because if you have, for example, stage 2, and you also have lymphedema with that, then you're a stage 2 and a stage 4. And that's just confusing for me. So we're trying to say stage 3 with lipolymphedema. So sorry, got all off on that tangent.
So irritable bowel syndrome, is that?
Irritable bowel.
Yeah.
So if you have lymphedema, your gut can become congested and swollen, and you may not absorb things correctly. And your gut bacteria can change dramatically for the worse, and you can develop irritable bowel. So I would say that, yes, irritable bowel can be connected to lymphedema. And also, if you have hypermobile joints or Ehlers-Danlos at the same time you have lipedema, then you have slow gut motility. If your gut just moves very slowly, then bad bacteria can overgrow the good bacteria, and you can get irritable bowel as well. And so I think improving the gut is very important in lipedema. Just making sure your gut's healthy, making sure your bowel movements are normal. I'm trying to have actually more than one bowel movement a day. I know I've got some patients who don't go for 2 weeks, and I think that should be an area. That should be an area of focus, is to really get that gut back to normal, because our immune system lines our gut. And so if your gut isn't working, your lymphatics aren't working there, your immune system is off, that all needs to be worked on and corrected to be able to actually improve your lipedema.
We could go on for hours, but I promised you a hard stop at 2 o'clock. Here's one last question, all the way from Brazil. Lillian Oliveira wanted to know about massage and the acceptable pressure, even with pneumatic compression. What is an acceptable pressure? And I'll ask you to speak to that. I think that there are some misconceptions about pressure.
So I think an acceptable pressure is one that does the job and makes you feel good. And for some people, that's going to be a lower pressure, and for some people, that's going to be a higher pressure. And it may actually be one pressure on one day and a different pressure on another day, because that's how you feel and that's how your body feels. And we generally kind of focus around 30 millimeters of mercury for a pump pressure, but you could increase that or you could decrease that. And if you're a very sensitive person, especially if you have Derkham's disease, or you just have super sensitive tissue, or you bruise really easily, you probably want to talk to your rep and start at a lower pressure. If you find that you try a lower pressure and it does absolutely nothing for you, then you want to increase that pressure. And I think pressure is good. You know, too much pressure can cause some damage, and too little pressure can do nothing.
Right.
So I think finding a good starting point for you, and then modifying your pump to change the pressure is probably the best thing.
And going back to what you always say, listen to your body.
Listen to your body. Let your body tell you what the best pressure is. And you know it. You put on the pump and you go, oh, God, that feels amazing. And then after you're done, you notice my legs look better. They feel better. My pain is down. If you put the pump on and nothing's happening, then it sounds like you need to talk to somebody and figure out what to do.
Bump it up.
We're working on that too.
Yes, I know. And so everybody is on the edge of their seat saying, Dr. Herbst is working on so many things. How do we keep up with it all? Should we refer people to your website for the latest and greatest of what's happening in the world of lipedema?
Yeah, I think eventually I'll get it up there. Right now, I've been working really hard on the standard of care and trying to kind of set up a practice. And once I get, you know, I kind of reach a place where I'm gliding instead of, you know, rushing, then I think I'll have a little bit more time for my website. And I let people know on Facebook. So if you're a Facebook friend, that's also a good place to get information.
Excellent. Well, we are very glad that you are not just our Facebook friend, but you are a friend of ours and a valuable resource to the lipedema community, both the clinicians and the patients out there. I think I can speak for you, Eric, when I say that Lympha Press is so proud to serve the lipedema community. Far beyond Lipedema Awareness Month, we're about you all the time, and we want to help. Follow us. We want to be part of your tribe to help support, encourage, and inspire. And again, we consider it such an honor and privilege to have had you here with us, Dr. Herbst, and we hope to do more of these in the future.
Thank you so much. Thank you for everyone who attended.
Yeah.
Dr. Herbst, thank you for being so gracious to give us a little extra time here. And I can't wait to see the standard of care pieces that you're working on.
Me
it's going to
too.
make a big difference.
I think so too. Thank you so much.
Thanks
you everybody for being here today. You're wonderful. And we hope to get to more in the future.
Bye, everybody. Thank you.